So I guess we all are back. So we are going to start the next topic, which is like we have done till now, what are the research methods? We have done the basics of qualitative. Then we did how to develop a protocol, what all should be the component of a qualitative research protocol. And then we are seeing how to develop an interview guide. So interview guide again, like we were discussing since yesterday, that it is a very like you can say it is a very flexible. It is not like a quantitative interview guide. A quantitative interview guide, you cannot change the questions and you cannot change the responses. Whatever code, whatever options you have made, it's very strict, and all the data collector have to abide by that particular research tool. But in case of an interview guide, it is very flexible in nature, and the questions which you formulate, they are just the rough guide. You can add any questions, and if not needed, you may not ask the questions also if it is there in the guide. So now, for a qualitative research, you should understand the difference between what is an open-ended question and what is a close-ended question. So let's start. So if I ask this question from a patient who is taking a treatment from AIIMS Delhi, like rate your satisfaction level at AIIMS Delhi on a scale of 1 to 10. 1 means the worst and 10 means excellent. So from a qualitative research perspective, what is the problem in this question? Can you type in the chat box? From a quantitative, it is okay, but from a qualitative, what is the problem? Close-ended, okay. Anything else? No insights? And again, AIIMS Delhi, on one response is restricted. We cannot know about patient perspective. Okay, so you are right. A lot of problems with this question, because, if I say like satisfaction, a level of satisfaction. So how you define this satisfaction? That is very important, because satisfaction is one word, but it has got many of the sub questions. Like, what is the problem? The patient might say, yes, that experience with the doctor was good, but their experience at the reception was very bad. He might say that, then we might say that why not take separate responses? Like I can say like rate of satisfaction at reception counter and rate of satisfaction with doctors at AIIMS Delhi. Then again, I might say that the doctor was very good, but he was not a very good communicator. Like I did not understand what he was saying. So if you go for a quantitative one, even if you use a rating scale, many times it is not possible for you to take every component into account, because this satisfaction domain, it is a very wide, and it might be related to many components, with the manpower, with the infrastructure, with the kind of facility, with the kind of behavior, gesture, it is there. Yes, so it is very subjective. So that's how you can see that for to remove these dilemma, because we are not giving any like enough opportunity for the person to express the experience in detail. If you ask open-ended question, definitely the person is going to explain that in detail. So in quantitative research, participant generally they respond through options. You give the questions and they put tick mark or some, they mark some response. But in qualitative research, they express through words. They always express through sentences, through verbal and non-verbal language. So then how to develop an interview guide? Because you have to do a participant in key informant interview or a patient interview. In that case, you should have a rough interview guide. So what is as a researcher, since I said we are discussing this since yesterday, that it's the researcher who has got the main role in a qualitative research. And there is a emic perspective, means the researcher is within the research and he is not just visualizing things from outside. So now it's the researcher responsibility to help them remember the participant. Like, that's why I said that you have to be very patient. And especially with the questions like how and why, you have to give them enough time. And that's how we say that at least you should wait for a minute. When you ask some question, initially the participant might not answer it, but don't be in a hurry to move to the next question or to, to answer it. So there are some probe and prompt. You can give them some prompt so that they can remember that particular response which you are desiring. So you should consider two main things whenever you are doing a qualitative research and you are planning to develop an interview guide. So first is the type of questions which you are keeping. So if you see the how, what, and why, these all lead to a open-ended sort of questions. These are not the close-ended questions. So what are the type of questions which you should be asking, and what are the type of questions which you should be avoiding? So generally, your interview guide should have 3 sections. You should have an initial opening section, you should have a middle section, and then you should have a closing section. So coming to the initial opening section, there should be some introduction between the participant and the researcher. Then you explain regarding the topic, why you are doing the research. You also give them the participant information sheet. You explain the purpose. You also explain them, like if they don't want to respond to a particular question, they can choose to do so. And during any part of interview, if they feel like not responding, or if they feel that they want to withdraw from the study, they can withdraw themselves from the study, and they will not have any of the adverse consequences after withdrawing from the study. Because many times patient thinks that, if they are coming to the hospital, if they will not respond, so there will be like doctors will not see them properly, or they will not get them proper treatment, because then ultimately it's the doctor who has to provide the treatment. So it is not so. You should always explain them that this participation is voluntary. And if they don't want to take part in the study, that is not going to affect the overall treatment of the particular patient or their relative. So those things should be told very clearly in the beginning of the study, so that the participation of the person or the patient, it should be voluntary, and it should be with the consent of that person. The second is regarding the second section, which is the middle section. It contains basically all the important questions, your interview questions related to your central phenomena, the main central question and the sub questions. And it has some prompts and probes also. We'll discuss what is the difference between prompts and probe. And then there are closing sections. So closing section are like you give you give opportunity to the volunteer if they want to add something new or some additional point, or if they have got some query, or if like some ethical issues, if they want to clarify, they can ask at the end. And then it's basically then you give the thanks and you end the interview.
Will it also include debriefing?
Debriefing generally, yes, while doing it, it depends on the time, how much time you have. So generally what we have seen in our scenario, like usually whenever we approach any person for an interview, they want to give minimum time, because they have come to the hospital for a particular purpose. So, and you should always ask. It depends on the setting where you are doing.
Is it ethically a compulsion that after you finish with the interview, you read out what has been captured and whether the respondent agrees that yes, I have accordingly responded or not responded?
See, like if you go by the books and the literature, they say yes. They say yes.
Oh, okay.
Ultimately, member checking, it can be done later also. Here, what we have done in one of the project, like since that project was with the people of the state government officials, so we made them the transcript, and because initially you don't have transcript.
That's the red zone you entered into, actually. So
yeah, until and unless you have got something written, they also don't remember what they have said, and you also don't remember everything. So what we did, like we sent the transcript to those they were like district immunization officers and state immunization officers. We
Right.
mailed them and they checked it. And then
Right.
maybe one person said that they don't want this particular section to be in the research.
Right.
We have removed that section. And then for rest of them, they were okay. So that
Right.
we can do depending on the type of participant. But like we did a study on vasectomy, and then again we did one study on, like I said, HIV and lymphatic filariasis. They're the kind of socioeconomic status. They're old. They don't have an email access. And
Right.
sometimes the patient comes to the hospital and then they go. Then there are issues with this member checking and debrief.
Right.
And if they
Okay.
are
So
in menopause,
I misunderstood. I misunderstood. I thought generally you do a debrief immediately after concluding the interview. So
you
not
can you
necessarily. You
can
can.
you can like just paraphrase their that you do in
Right.
between also, that you are
Okay.
saying so what do you mean, you paraphrase their statement,
Right.
just making them confident that you are listening, you are doing active listening. But
Right.
I think everything you also don't remember, because if the interview is for like 20 to 25 minutes, you can only tell that you said some major thing, but exactly or what all
Right.
happened during the interview process.
Right.
Immediately, I think if I can recall my interview, even I was not remembering each and everything, because you
Right.
generally
Right.
rely on the recorder.
Right.
So
Right.
yes, after every question, you can summarize like that. That's what I said. You can paraphrase. You can
Paraphrase. Paraphrase is best
paraphrase
actually.
so
Yes.
that they yes they know that we are actively listening to them, and
Right.
that's the only thing which I thought which we have been doing, maybe
Right.
to make us remember that we have understood them correctly.
Okay.
So
Thank
that's
you.
thank you. And otherwise, for patients, it's very difficult. They don't
Right.
have even the
Because
small.
as it is at the outset, we have taken their consent. So, in good faith, we are taking the interview, and I'm sure none of us want to dilute or digress from what the respondent is saying, actually.
Yeah. So then coming to the question. So again, this is one question like, is there any fixed guideline to make an interview question in this case of a qualitative? Yes, what is the answer? Yes, no, or can't say? Fixed guideline means like you should have these many open-ended questions, these many close-ended questions. So yes, everyone is answering no. You are right. So now coming to, so you are as a researcher, you are free to develop your own interview guide. There's no fixed guideline. How should all the guidelines, like with what we are also telling, that is a very rough guideline. And that is only dividing your interview guide into sections, like what you all keep, and even the sequence of the questions, that's not fixed. You can go, like if the person is answering a question somehow, which you have kept it at position 7, then you will start with interviewing on the component which you have kept at question number 7. It's not necessary that you have to go like question number 1, 2, 3, 4. Many times when we train here the residents who are doing the qualitative research as a part of PG thesis, so initially they are very novice and new, so they think like we have to ask in that order only. So even if the person is answering, intend to answer or hinting us towards question number 7, they will say, no, you have to answer this in the last. So right now you answer this. So then that hampers the process of the flow. You have interrupted the flow. So I don't know whether the patient will answer with that much intensity when that question actually comes. So that's why I said that it's just a rough guideline, and you have to be very vigilant while you take the interview, that we'll discuss. So interview guide, there are some important tips. The first is, like we said, that you should do a literature review. So with that literature review and literature map, you should have a basic framework, which we say generally, that on what topic or on what sub questions you need to interview the person. Then you ask some initial light questions like uh, what is their like from where, like generally we ask like they are basically traveling for long, like for 1 hour or 1.5 hour. So we generally ask like how was their journey, what all they have used, and are they how have they managed the children at home. So with these some personal questions regarding their occupation, their work. So then it is a kind of ice breaking. They start talking with you. If you ask questions related to something very light, and then you come to your own main central theme questions. So you should always spend, although you will think that it is leading to no killing time or so, but don't think that way. Initial 3 to 4 minutes of talking with the patient helps in building a rapport, which helps in asking more questions of more depth. So again, we start with some very broad questions, like we have seen with the central question, and then we go on narrowing down each questions to know the detail. And many times you need to ask many hypothetical questions also. Like, what is a hypothetical questions? Like if I ask this question, after amputation, how your life got changed? So it is not necessary that everyone will get amputated, even if I'm interviewing a quality of life in diabetic foot patient. So I can give a hypothetical question that what do you think would have been different in your life if you haven't been, this is from a person who is having a leg amputation. So you can give this like, if you haven't been your leg amputated, so how do you think your life would have been different? Like in case of a sarcoma, yesterday we see a phenomenological interview, like just the narration of the sarcoma patient. So you can ask like, how do you think that your life would have been different if you did not develop this sarcoma or a cancer? So then they would have tell what all they are missing. Because many times if you ask direct questions, they are clueless what to answer. So hypothetical questions are very important. And many times you will see that you will get a very good response in hypothetical questions. Generally, we ask in health system research from patient, like if you are the administrator or if you are the in charge of the OPD in the patient satisfaction, you can ask like what all you will try to improve, so that then you will have an insight on how to solve the problems also. So, like if you are studying a student belief about group activity, so what one of the question you can ask from the student? Then you can ask this like, what do you suggest to improve good activity? So you can reframe this question as a hypothetical question. So all of you, please do this activity. If my direct question is, if I'm asking this question like, what do you suggest to improve group activity? How I can frame this as a hypothetical question. Yes, can someone say something? Anyone? Like you can tell them like if they are the teacher, okay, how was your journey in this college? So again, you can, because you are asking this as a teacher, so you put them in teacher role. And you can ask that if you are a teacher, how will you plan a group activity? Like I said, for the patient, if they are the hospital administrator, what will they do to improve the patient communication? So if you pose such questions to the person, they might come up with an idea which it is there in the semi-conscious mind. And if you put them in the active lead role, they might come up with the solution also. So yes, Dr. Natasha is writing, if you are a medical educator, how can you plan an activity to improve? Very nice. Or Dr. Abhijit is writing, will an outdoor group activity help? Okay. But again, this is a leading question, because the answer will of this question will be yes or no. So generally in case of a qualitative, if you are asking a close-ended question, then you will not get an idea. Again, Ekta is asking, what is your opinion about group activity in medical curriculum? That can also be asked. So these are some of, but again, in your opinion, it will not be a hypothetical question. So in hypothetical question is a question where you ask the respondent to be in a situation where he's currently not. So then you can ask him to be in a role, maybe in a teacher role, in an administrator role, or currently if he's suffering from some disease, then hypothetical will be if he is not suffering from that disease. So you just ask the opposite and then ask his opinion or his views. Then again, the next step is you should again think about the data analysis while framing the questions. This is very, very, very important, because once you see the transcript, it becomes very clear what is the data quality. So in case of a qualitative, it's the words and sentences which are the data. It's not the numbers. So if, like I said, with few of my initial transcript, my paragraph was like 6-7 sentences, and patient was saying like 1 or 2 lines. Then I was like, what to analyze? So you always think from the perspective of a data analyst, that if the interviewer is saying so much and interviewee is saying less, then you will not have that much insights and data too, and then you can call it as a missing data. And that's why in many of the, like, we will select some interview and we'll share it to you people just to comment critically. You can see the transcript and you will see that there are only one line researcher and one line interviewing, one line researcher and one line interviewing. So in that one line, what insight, what interpretation you will do? You cannot do any interpretation. Even the descriptive you cannot do. So that's why you should always think of analysis whenever you are framing a question. So let's develop an interview guide. So first, I'll open all of you. This is when you will go in the breakout room. We have shared the Word document, the Google Doc with you people. And then you should write your research question first in the beginning. Like, what are your research questions and sub questions, which you have done earlier in the protocol. And then you should focus on one research question and its sub questions, and you try to write as many questions as possible. And again, it should have a open-ended. So if the answer to any of the question is in yes or no, that's a close-ended question. And if you have asked something where the patient only says yes or no, then it is known as missing data. You don't have any data to analyze. So never ask close-ended questions. You should always ask open-ended questions. And then once it is done, your interview guide, you should again see it once, and you can refine and rearrange. Again, depending on the, like we discussed, you can have initial 2-3 interview using that interview guide as a pilot, just to improve the interview guide. And then you can have a final interview guide. So if this is, I'm using this example, this was one study which we did, qualitative descriptive in our field practice area, which got published recently. We'll share the article with you people also. And I will be doing the analysis on its transcript and the codes and theme what we generated. So this we have done the exploring the barriers to effective patient communication among, okay, so this is the same question, research question which we have shared. Exploring the barriers to effective patient communication among healthcare worker in managing chronic disease. This is the same. So whenever you develop a interview guide for your study on communication barrier, then you have two main approach. The first thing is you can develop your own framework. Like what we did, we developed our own framework. Or you can use your existing framework also. There are some existing frameworks related to patient communication. So in this case, these are the two examples which we have just shown. This is something like if you have got grocery items and spices, so you can make your own food. Or if you don't want to make your own food, then you can order from restaurant. So these are the two approaches which you can do in case of a qualitative developing an interview guide. So if you have to develop your own framework, like we discussed in the literature map, so you need to do a thorough literature review. You make a literature map, and then probably if I have made these 4 main theme, or you can say as a category, like perception of communication barrier, what are the influencers of communication effectiveness, what are the healthcare decision making, which got impacted by this communication, and what are the institutional or the systemic barriers. So I have identified these 4 main themes. Based on that, I will have my interview questions. Or again, this is a tentative framework. It may vary from person to person, and what all attracts a particular researcher, he can put that particular theme also. Or we can use some existing framework. So these are some names which we have just found out from the Google. You can say that these are the existing framework, like the capability, opportunity, motivation, behavior framework, the 4 habits model, the health literacy framework, social ecological model, theory of planned behavior. So these all are there. You can type in Google. If you write like framework related to patient-doctor communication, you can get these. And then you can go into the detail. I have not gone into the detail of any of these framework. Since we have just used this as an example of showing it in the workshop, I have actually not worked in any of these framework. So because whatever we have done, we have used our own literature map to ask questions. But if you see a proposal, you will see that many, especially the international organization, I have seen that they use some framework as a method of inquiry. Maybe sometimes they say that it is already proven, so they want to use their data, like the data of a particular population, to fit into this particular framework. So what I have seen working with few organizations, like they tend to have some existing framework and then they make inquiry. But what like I have only we have done mostly the qualitative descriptive. So there we developed our own framework and we have started analyzing and taking the interview, having our own framework. So yes, Mitasha, you have raised your hand. Do you have some?
Yes, ma'am. I have a query regarding frameworks.
Yeah.
Do frameworks do not work when we are doing a grounded theory approach methodology?
Generally for grounded theory, because you are developing
Yes,
new theory, so it generally doesn't work because you cannot find out any shortcomings in these theories. These are well accepted framework. So you
right.
cannot say that you are going to fill that gap.
So if we see in a paper both things, grounded theory and a framework, it means there is some discrepancy in the methodology.
Yeah, and that we will share one article with you where the author has like critically analyzed all the qualitative studies, and she said that the way they write that it is phenomenology or it is grounded, actually it is not. So if
Okay.
you match the individual component, and even if somebody writes that it is a grounded, see, you also do the a lot of critical article as a part of PG presentation. There you will see that like person who has used the matched case control study, but he's not using the conditional logistic regression as a part of analysis. Or maybe they have written the matching, but the kind of result which they are showing that is different. So a lot of mismatch you will find in the quantitative results also whenever you do the critical review of the quantitative. Similar in the qualitative also, if you see that many times they write it is grounded, but actually if you go deeper into the methodology, it is not grounded, or many times they use the mix of approaches, something of phenomenology, something of grounded, something of narrative. So ideally, it becomes like a khichdi, like
Yes, got it, ma'am.
you don't really come to know like what approach they have used. So maybe, I don't know, because everything gets published at the end. Even if you review
Yes,
your own article, which you got published 5 or 10 years back, you will find many fallacies in your own article. So with
right.
time, we also improve, and like that's how the system works, and we are also working. So ideally, whatever you read, it is not. I should not say that you will find every component. So like in grounded theory, if you see, like there are two people who have worked in the grounded theory. The second one is the Charmas. We will discuss that in the analysis. So Charmas says that uh, we should be flexible in developing this grounded theory. But then again, there is Strauss. Is there? There is one other person, which is the Strauss, who has given this grounded theory approach. He says that you should start from zero. So there are two approaches, and if you see the article also, they write that which framework they are using. Are they going by the Charmas grounded theory, or they are using the Strauss? So for the Strauss, you will start from zero, and Charmas says that even if something is there, you can develop starting from that.
Right.
So
Thanks, ma'am.
that is there. But uh, frankly speaking, I have not used any of these existing framework because I always think like, see, in their population and things in our population. Many times I've started that social and contextual, there is a lot of difference what they have proposed, because generally all these have proposed in the Western this thing. So either we should propose something, or we should go like starting from zero when there is nothing and no framework is there, and you start exploring your own way. So you can choose to adapt of your own framework, and then you design your interview guide. So this I said like this we recently got published, which was a simple study qualitative descriptive of, because we wanted to have a what is the patient perspective, why they don't what are the barriers of the basic lymphedema management, because in our field practice area you will see that there are a lot of patients with the lymphedema, but when you go and take cases, because as a part of MD and MBBS teaching, we do allot them the cases, and when they you ask about the lymphedema management, you will not get a concrete answer why they are not following a particular strategy. So that's how we did this with the healthcare worker, with the patients and their relatives. And this was the title, this title we have selected from that one of the healthcare worker perspective, that whenever I tell her to wear slippers, she turns a deaf ear. Because you know that in lymphedema, generally the limbs are swollen. So special, even if they provide the special slippers, they don't listen. So maybe we could have used some health belief model or something like that, but we did not. We have just kept it as a qualitative descriptive study. So I will use, like I was saying, that we will use this study showing you the other components like interview guide, and then for the analysis also in the QDA minor. So the research, this aim was to assess the perceived barrier to lymphedema. Ideally, I should not be writing aim here. It should be the main central question, to assess the, or to explore the, assess is also not that much good. So explore the perceived barriers to lymphedema management and quality of life in lymphatic filariasis patients in rural Bihar. It is written rural Bihar. You can add the specific setting also. And then you have to define, because my central phenomena here was the barriers to lymphedema management. So then you have to define what is lymphedema, and how you are going to use this word in your research. So we have identified 3 research questions. First was what are the perceived barriers to basic lymphedema management? Then what are the coping mechanism or strategies do these lymphatic filariasis patients use to manage their lymphedema? And how do these perceived barriers impact their quality of life? So these were the 3 questions. So let's develop, I'll show you how to develop an interview guide. So I'll start with these 3 broad questions. So this, your interview guide, because you have to give this interview guide as a part of supplementary material. Also, many times the journal, they ask for supplementary material, and you can upload if you want to help others, or if you want to make if you wish that other people should go through your interview guide, then you can upload this as a part of supplementary material. So you can start with welcome and introduction. That's what written here. That is the initial section. So what we discussed, that your interview guide has an initial section, then a middling section, then a closing section. So if you see this, this section is the initial section. This is the initial section. So like welcome and introduction, then you have to introduce yourself, and then you explain like we did regarding the informed consent, regarding their role, and then we are many times what we do, like we take the audio recorded consent, because if you think that, especially in case of a FGD, we take the consent and we audio record it. So you can say, like, before we begin, I just want to remind you that it is voluntary, and you can choose to stop any time or skip any question, and it will not affect your treatment or whatever our relationship is before this interview. and then you can ask regarding the basic demographic questions. So these are some, if you see these questions, these are the questions which are my mains from the literature review, and this RQ which I have shown you, like knowledge about lymphedema and filariasis, healthcare practices and treatment, what are the barriers to effective management, and what are the systemic and the healthcare system barriers in receiving the treatment.
I have a question.
Yes.
Yeah, basic demographic questions. Under those, do we detail them? Because my previous experience shows that when we are analyzing the information, the socio-economic demographic features of each respondent has a lot of value in the conclusions, the findings.
So
So do
yes,
we?
in the QDA minor and in any of the software, you see that this section is there. When you have to describe, you actually make a table there in the QDA also. The basic thing which we take is the age of the person, gender of the person, occupation, and socioeconomic status also. If you are, because whatever relevant, like in case of a doctor, when we interviewed regarding the this communication, we used to take their specialty also, like whether they belong to orthopedic or surgery, because what we have seen that pediatrician, they are like more effective communicator as compared to the surgeon. So like
Right.
you can take the basic if you think what is necessary. So like you are saying socioeconomic status, yes, because in case of a lymphedema, we did not take because they were belonging to us one rural community.
Yeah, because there, what if one respondent is a sarpanch? You know, that
Yes,
person
yes.
would have a different.
Agree. Agree,
So from
agree.
that
So
perspective,
in that case, we take the generally we take the occupation. And if someone is like it in that position, then we write it like when we are taking the healthcare this thing, then we write like one is Asha, the other was A&M, the next was one medical officer, the other was one medical officer in charge. So because
right.
socioeconomic, I'll tell you, yes, in quantitative we do take it, but there's a lot of problem with the socioeconomic also. If you are going to directly measure, and for us it is not that much important that you ask them wages and all, because in rural area that
No,
there are
no, I agree with you. No wages, but I wanted to highlight the stature of that
yeah, yeah,
particular
yeah,
respondent, actually,
yeah,
because these are public influencers. They have better understanding. They would have better or different responses than somebody who's probably a daily wage worker in the
yes,
field,
yes.
actually. So from that perspective,
So generally we describe more as a form of occupation, like if he's a
yes,
petty
okay,
shopkeeper or a like daily wage worker or not doing anything and dependent on son. Like in our
right,
case, there were few elderly people who were only having like 500 pension, and they
right,
were getting the support from their sons. So
right.
those things you take
Or a,
not,
or a housewife, or a housewife. She would have a
yes,
different perspective, actually,
yes.
of.
So rather than in terms of like wages and money, we ask them their profile of work
Yes,
and their kind of work probably. But
right.
again, it is up to you. See, there is no said rule in qualitative. You can take
Right.
like whatever relevant. And then yes, one more person raised her hand, I think, her or his hand, while I was okay. So if there are no questions, then you can see like first question is related to knowledge of the lymphedema patient. So if I just request, you need to give me edit access because I cannot write it. I have requested. I'm just asking for access. It is through some other email ID, that's why. No, it is not. Okay, okay. I'll open it. Just a sec. I've opened another document and this I can edit. Yes. Thank you. So like if if you start with basic demographics, so you can start with questions like the occupation, the gender, but still you need to make these issue, because when you write in the bracket who said this, then you write that this was the statement of a 31-year-old female housewife, something like that. So you don't use direct identifier, but you use some indirect identifier. So you generally ask the gender, the occupation of the person, and then you ask probably if they are a specific position in the society, if they are having, then also you ask those things. Then coming to the other questions like knowledge of lymphedema and filariasis. So you can ask simple like open-ended question. Like, can you tell me regarding filariasis? Or what do you know regarding filariasis? And this you need you need to translate this into local language, because I am writing in English, but in Hindi, maybe they call it as filariasis, maybe somebody calls it as, generally they know it as a filaria, but if there is some local term which is being used in your locality, you should be aware of those terms, and then you should translate these questions in Hindi. In our area, maybe depending on like Tamil or Kannada or Marathi or any other language that the people are using. So can you tell me regarding filariasis, or what do you understand? What do you know about filariasis? What do you know about the disease? So here you are asking open-ended question. Or I can ask like, in your experience, what do you know? In your experience, what are the common symptoms? What are the common symptoms of this disease? So you can ask these questions in the lymphedema.
I have a question here.
Yeah.
Yeah, are we assuming that the respondents here have never sought treatment for filariasis? Because their knowledge would be different if they've already sought than who are actually never been to any health center.
So that actually this will come in the as a response to this question also. Like if you ask like what are the common symptoms, they might say that we don't know much, or they might say yes, we know this, because generally they have sought treatment. They are the chronic patients, because lymphedema, it's a long-standing filariasis. So generally, while they take this treatment from the local practitioners, from the healthcare system also.
So that means you're suggesting that the respondents are surely the ones who have been affected by filariasis, and not probably the relatives or some friends as well as in the pool of respondents.
Yes, and many times you see like they take the medicine. It's a must. MDA usually it is there in our area. So they take the medicine, but they don't remember that the medicine which they take, that is for which disease. Because many times they say that they come.
Correct. No, I wanted to know whether we also include respondents who have not suffered from filariasis, but probably can have some insights.
Up to you. Up to you. Up to you.
Okay.
It depends on your research question, and it depends on how much inquiry you want to have with all stakeholders. So that's
right, because here we are looking at purposive sampling. That's why I asked. I mean,
yeah, you can definitely. It's a totally your choice whom you want to include. Like we included the patients, their relatives, and healthcare worker. Dr. Abdul is asking, do we need to validate these knowledge questions? No, no, no. No validation is needed in case of a qualitative question. And even in the translation also, like you do it for the scale development, it's not needed, because ultimately it's the researcher. We assume that the researcher is going to ask this question. If you have to train the field investigator, then it is not that hard and fast use of words and all. Again, it said it is very flexible, just a rough guide. Maybe the words which you are using, if the patient is not understanding what you have written in the interview guide, the things might go in some other thing. Like we conducted one interview where the person was not understanding Hindi at all. He was understanding there's a term like Mathili in Bihar also. There are many dialects. In your area also it must be there. Because when you are interviewing patients, like ideally you should know the local languages also. So that patient was not understanding Hindi. Then we had to conduct the interview in Mathili, which is one of the language here in Bihar. So yes, it is not that translation purpose that doesn't work here, like Hindi translation. Many time it is in English, using some words in Hindi, some in English, some in Mathili, some Bhojpuri. You have to use a mix sort of thing. Terms, common terms. So it is very flexible in nature, nothing like quantitative. And then coming to the healthcare practices and treatment, you can ask questions, right? If what are the practices, like what do they do? What do they do if they have chills after lymphangitis, probably, or during the edema, during edema, something like that. So you can ask these questions, and similarly you can expand. So I will show you the full drafted questionnaire, because otherwise it will take time, but I have just shown you how you can develop. So this was the full question. Like knowledge of lymphedema, can you explain about lymphatic filariasis and lymphedema? These were the questions. Then I have asked, like, how do I identify and manage patients? These were regarding the healthcare practices means from the doctor. So there will be separate guide for doctors, for the relatives, and for the patient. There were 3 interview guide. Similarly, if you identify the stakeholders, and depending on the number of stakeholders you have in your research, you develop those many questionnaires, because the questionnaires will be different from healthcare personnel and it will be different for patient. And then these are some other questions. So again, these are some rough guide. I said that these are only very rough guide, and you don't have to go in sequence the way it is written here. You can, if the person is telling you about something regarding the, let's say, the support from healthcare system. So you will not ask him to answer question number 2, which we have kept here, like healthcare practices. So that sequence is just a rough guide. And again, like those of you, these things, when you start taking the interview, you might see that some new thing has come up, which you have not anticipated earlier. And that is always there, because when we drafted that questions on HIV, there was one person who in the stigma said that he did not disclose his disease to anyone. So that was very surprising for us, because his status, even the family members, they were, because he was a migrant worker and working in Mumbai. So he said that I have heard that, if I will tell this to someone, I'll be killed by my own family members and by my own society, because I've seen that in my locality there was a cow who was suffering from some disease which was fatal. So they killed the cow. Similarly, they will kill me. So that was the kind of stigma. So then we inquired further, like from where you got this perception, and how can you say, like, what all made you think that killing of cow and killing you will be the similar thing. So remember, that's how, if you are into that interview process, I'll tell you that many times the kind of answers which you get, you are not, any of these questions you will not be interested in. There is some new insight which has come up, and you are interrogating that particular belief of the person. Remember, so I said that these are only very rough guide, and mainly when you conduct the interview, there might be a case which will go according to this guide, and there might be a case which will behave exactly different, and probably he will say something very unique which you have not thought of initially. Okay, that's what. And again, I said that particular case you can publish it separately as a narrative analysis, because you have started with a qualitative descriptive, but one person you find very unique regarding this particular belief, and you can make a story. You can take it separately, co-construct the story with the patient, and then you can publish that separately also. You can report it separately also. So this is the rough guideline for the interview guide. And then we are again coming back to this breakout room activity. So the background of this is again the protocol which we have shared, the communication barrier between the healthcare worker and the patients in the chronic disease management. And we have identified these factors like language differences, the cultural misunderstanding, lack of health literacy, and some systemic factors also. The aim is to assess the perceived barriers to effective patient communication in healthcare worker. And then this is the framework. So you have to do an opening section, introduction and rapport building. There are some middle section, and then there's a closing section. In the middle section, it is like understanding of communication practices, barriers to communication, and what training and support is needed. Since we are only using the healthcare provider as a stakeholder here. So in each breakout room, Dr. Supriya, you can see the number of participants, and you can allot like 4 people in one room, and there will be total
Yes,
10.
ma'am.
There will be total 10 minutes to make a rough draft of your interview guide. Yeah. And we are compiling it from our end. So after getting responses from you people, we'll compile a rough interview guide. And using that interview guide, you have to conduct the interview in the next breakout room activity. So again, in that sheet, please write your respective room number, the Google sheet.